Wall Street Journal dropped an article today talking about the biggest health insurance cost spike in 15 years. Here are the top takeaways that you need to know as an individual buying health insurance or a company that's providing it to your employees. So the first thing, just to give you some context, the family premium, according to the studies that have been run, the average cost per family going forward in 2026 is going to average about $25,500. Oh my gosh, that is the price of a car for a lot of people. What's actually driving the cost increase? According to the study, it's going to be hospitals who are pushing for higher prices. They're often using AI-backed software to help code. They're also using this AI software to dispute a lot of the claims. The government passed what's called NSA, No Surprises Act. It's really designed to help people that are insured against balance billing in certain situations. But a lot of these facilities, they're using AI-powered software to dispute these claims and wring out higher reimbursements. At the end of the day, you might be watching this thinking like, well, it's actually good that my doctor gets paid more. Well, when insurance companies pay more than they should for healthcare, what do? They raise your insurance rates to cover those costs. But what are some of the other things that are driving prices higher in 2026? There's rising utilization. There's a lot more incidences of cancers, cardiovascular disease, musculoskeletal conditions in the working age population. There's an explosion of high-cost medications, particularly GLP-1s. These drugs that you see advertised on television for weight loss now, but it's also for type 2 diabetes. Those drugs are not cheap. I'm not here to say whether they're good or they're bad, but there's a rising incidence in them. And when the employers that we work with, they're seeing anywhere between a 30 and 50% cost increase of their total plan just because of GLP-1s. Employers, they're left with some pretty tough choices. The big one that's going to affect a lot of us is that employers, they're shifting cost through payroll deductions and out-of-pocket costs. What does that mean? It means employees are probably going to be paying more than they were last year for health insurance, and they're going to be paying more out of pocket when they go to get care. This is just a simple math equation. How are we managing in traditional markets? Most employers, that's really the only lever that they have. Which is really why, if you're an employer, it's important to understand the options that you really do have available. If you're using a traditional plan, a traditional network with a traditional carrier, those are really the two options that you have is, can we charge more to our employees, and can we help reduce the premium by increasing out-of-pockets and deductibles and copays and all that stuff? Smart employers, they're figuring out, okay, where is their waste? Where's their abuse? Sometimes by providers, sometimes by the insurance company themselves. Sometimes, yeah, believe it or not, insurance companies make more the more we pay for certain types of claims. Where does your carrier profit? Take that away from them. Use them for what they're good at. They're reshaping plan designs, narrowing networks. They're limiting coverage. Surprise, surprise. Increasingly, large employers, 60%, according to the survey, they're saying that they're shopping for a new carrier or a PBM in the next few years. Now, that can have a couple of different meanings. If an employer is actually looking at alternative plan structures, meaning partially self-funded, we're going to use an independent pharmacy benefit manager, we're going to go directly to a hospital and get a better price than what they give insurance. Again, looking at ways to reduce the cost of healthcare is how you reduce the cost of insurance. The big insurance carriers, they don't do that. Everybody's in network. And if you're a hospital facility, you're thinking to yourself, what advantage do I have over the hospital across the street by accepting this PPO network? These hospitals, at the end of the day, the way they're subsidized or paid by Medicare and Medicaid, they're having to subsidize their operating costs, and they're doing it through entities they can negotiate with, which is your big insurance company. A lot of smart employers have figured out, I can actually get a better deal if I just ask the hospital, can I get a better price if I make your facility less expensive than the one across the street? And often employers are getting anywhere between a 25 and 35% discount compared to staying in their traditional network. You can still have a network around that direct contract, but give your employees a lower cost, lower out of pocket, reduce your claim costs, reduce your health insurance costs at the same time. A facility ends up being a good guy. At the end of the day, everybody's winning in that scenario. Really, at the end of the day, it's the cost of healthcare that's driving the rising cost of insurance. But what's interesting, if you look at the data, we've talked about this a number of times. You can cash pay for stuff and get a better deal than using your insurance. How crazy is that? So why not insert that sort of programming in your plan? If we know there's a better price, why are we relying on this insurance company that's out of state or somewhere else located in the country that's going to dictate the price of insurance that we pay, which, by the way, doesn't really have an incentive to help lower costs. It's not their money at the end of the day. Whether you're fully insured or you're self-funded, you're working with a big national carrier, it's not their money, because guess what? When they spend more on healthcare, they're just going to get it from you at renewal. Every employer, and I say this all the time, every employer, whether you're fully insured or you're self-funded even if you're fully insured. Why? Because as claims continue to rise, the carrier is going to charge you more at your renewal. Nobody's going to pay, or nobody's going to charge you less than your claim cost. They don't make money doing that. They're going to take whatever your claims cost are, and they're going to tack on a profit margin for them to cover their overhead and profit that they need to make. And boom, there's your health insurance renewal. The way to lower the cost of health insurance is to lower the cost of healthcare. And you do that by working with facilities that want to get into direct contracts to give your company and your employees better prices for healthcare. And when you do that, oftentimes you can reduce their out-of-pockets, reduce their deductibles, reduce their copays. When you work with independent pharmacy benefit managers, you can take out spread pricing, the whole rebate game, and maximize the formulary, and provide programming that helps you acquire those medications for your employees at a lower cost. Your employees get those medications at a lower cost. Your company's paying less for them at the same time. When you use programming like that, you can reduce the cost of healthcare, thereby reducing the cost of insurance, providing better benefits to your employees. That's where smart employers are moving in today's market, to get out of this ever ratcheting up effect of health insurance through traditional insurance companies. You can still have a traditional insurance company logo, but there's a better way to design a health insurance plan. And I've said this before, and I'll say it again right here. There is, especially in this market going into 2026, you're an employer, you have health insurance for your employees. You've been dealing with this for so many years. Costs have continued to rise. This is going to be a very large increase health insurance cost year. There's this bifurcation between the employers that have figured it out and they have reduced the cost of their health insurance. They're providing better benefits to their employees. Their employees have access to affordable health care. They're getting the care that they need when they need it at the right price, and they're saving in the process. Those companies are going to look very different than the employers that have not figured out how to do this, and they're stomaching 10, 20, 30% increases. They're shifting that cost back to their employees. They're raising deductibles and copays and out-of-pockets. What does that do to those employees? One, they're paying more out of their pocket every time they're buying health insurance. Two, they're exposed to much higher deductibles and out-of-pockets when they actually need health care. And the third order effect of that is they're delaying or just not getting the health care that they need because they can't afford it. What does that mean for you as an employer? At some point, that sickness, that ache or pain that they've got, whatever the situation is that they've been setting off to the side for the last 6, 9, 12, 18 months, it's going to at some point get really bad for them, and they're going to no longer be able to put off having that care, and that care is now going to be catastrophic. What could have been prevented with a simple procedure or a simple medication now lands somebody in an ICU because they didn't manage their diabetes, they didn't manage their hypertension because they couldn't afford their medications or pay the out-of-pocket costs for testing. Those people are going to end up as catastrophic claims, which guess what? Is going to get factored into your renewal. It's like this circular reference of expensive healthcare, expensive insurance renewal, which it can be avoided, where everybody can win. So my prediction here, and we can sit this down, it's September 10th, 2025. We're going to look back, and there's this wave of employers that have figured it out and those that haven't. The ones that have figured it out are going to be more competitive financially, more competitive with their benefit package. They're going to attract and retain those employees that you want. And those that have not are going to be at a disadvantage. That's my prediction. I hope it helps. If you like this content, like and subscribe. Use this information to put more money in your employee's paycheck and more money to your bottom line. Until next time, take care.